Let's talk about pulse taking, abnormal rhythm, hesitant pulse, a choppy, rough, and sluggish or senmai. As a hesitant pulse. The hesitant pulse has an overall even or slow rate, but like the hurried pulse, there are irregular intervals without pulsation. The hurried and the hesitant pulses differ principally in their overall rates. The clinical significance: a hesitant pulse suggests such conditions as vigorous yin with stagnated qi, cold phlegm with blood stasis, and abnormal mass with food retention. It also suggests insufficiency and decline of the visceral organs with deficiency of both qi and blood. The latter is common in diseases of the heart. Here we see the analysis of a choppy pulse. There are two factors to contribute to the formation of the hesitant pulse. One is impedance of blood circulation due to qi stagnation, blood stasis, turbid phlegm, accumulation, or food retention. The impedance of blood circulation leads to a slow or at best even rate with intervals without beats. The other factor is deficiency of qi and blood due to visceral insufficiency, and this condition also leads to impedance of blood circulation, hence a hesitant pulse. A pulse which feels thin, minute and short, and has an uneven flow, beating 3 and 5 times with irregular rhythm, is called choppy. It feels like a knife scraping bamboo, rough and jagged. It is easily scattered like rain falling onto the sand. It also moves very slowly and at irregular depths, like an ill silkworm eating a leaf. The choppy pulse must not be confused with a scattered intermittent or minute pulses. The choppy pulse has a root, and although it seems to scatter, it does not. This is the primary differentiation from scattered pulse. The choppy pulse does not stop periodically, unlike the intermittent pulse. The choppy pulse can be clearly felt at the floating and deep levels, unlike the minute pulse. The choppy pulse usually results with a deficiency of yin blood with damaged jin yi. It therefore occurs in severe stomach obstruction or even when severe sweating damages the jin and yang. It also manifests when cold, damp, perverse qi penetrates to the yin level, causing blockage and stagnation of blood circulation. A choppy pulse in pregnancy means that the woman has insufficient blood or to nourish the fetus. A choppy pulse in a non-pregnant woman means the jing and blood are drying up and it would be difficult for her to conceive. The kun, the guan, and the qi. The kun position becomes choppy when damaged heart blood causes chest pain. The guan position becomes choppy in weakness and deficiency of the spleen and stomach, where qi stagnation at both sides of the rib cage causes fullness and swelling. The qi position becomes choppy when damage to the jing and blood in the lower heater results in knotting in the intestines, causing constipation and dribbling of urine, or intestinal wind causing bleeding. Thank you for your attention.